Cancer-related changes in thinking. Some people with cancer have changes in their thinking, such as the ability to think clearly. You may have heard these changes called cancer-related cognitive dysfunction, chemobrain, or chemo fog. Cancer-related changes in thinking can be different for each person. Some of the most commonly reported changes include forgetting things that you would normally remember, such as the name of someone or where you put something, or not being able to find the right word to use when talking to someone, or to name a common object that would come to mind easily at other times. Losing your train of thought in a conversation. Some people with cancer report slower thinking or difficulty with thinking clearly. Symptoms may include having trouble concentrating on just one thing, especially for a long period of time. Others report being easily distracted, which makes it hard to do more than one thing at a time. This may make it hard to complete projects or tasks, both at work or at home. It may also be hard to come up with solutions to a problem. Cancer-related thinking changes may be very mild and easily missed when they begin. Over time, these changes can become more of a problem and may affect your quality of life. In the past, it was thought that these types of changes in thinking were largely caused by chemotherapy treatments. We now know that there are a number of possible reasons for these symptoms. Along with chemotherapy, other possible causes for changes in thinking include stress, depression, or anxiety due to emotions that can sometimes happen with a cancer diagnosis, or from the medicines used to treat cancer side effects, such as steroids or medicines for pain, nausea, or sleep. Other causes may include surgery and the anesthesia drugs given to you during surgery or for other medical procedures, or from radiation therapy to the head and brain. Bone marrow transplant, immunotherapy, or the cancer itself can also cause mild changes in thinking. There are certain risk factors that may increase your chance of cancer-related thinking changes. These risk factors include age. As we grow older, we are more likely to have changes in our thinking skills. You may be more likely to have these changes if you have already struggled with memory, thinking, anxiety, or depression before your cancer diagnosis. Frequent problems going to sleep or staying asleep can cause you to feel tired and make it hard to think clearly. Pain can make it more difficult to stay focused on tasks. Dehydration or poor nutrition can cause your brain to not be as alert as needed for problem solving. Relying on substances such as caffeine, alcohol, or street drugs may also increase your risk of cancer-related thinking changes. For most people, the changes caused by cancer-related thinking problems are mild. People with these changes often find that they are still able to do their normal daily activities. However, some may find that they are not able to do them as well or as quickly as they did before their cancer diagnosis or treatment. These symptoms can start before the cancer is found or at the time of diagnosis. For many cancer survivors, symptoms are not noticed until after their cancer treatments have started. Thinking problems often improve or go away within 1 year after cancer treatment has ended. But that is not always the case. Research is helping us understand more about cancer and cancer's effect on the brain. How long your thinking problems last can depend on the type and location of your cancer, the type of cancer treatments you were given, and if you have any other risk factors. It is important to tell your doctor if you see any changes in your thinking. It may be helpful to keep a list of your symptoms and concerns to share at your appointment. Write down anything you have found that makes your symptoms worse or better. Your doctor will review your medical history to see if your symptoms may be caused by any medicines you are taking or from other health problems. For example, they may check to see if you have a sleep disorder, hormone imbalance, infection, or other condition that, when treated, will make the symptoms improve or even go away. If you continue to have problems with your thinking after being treated for these conditions, your doctor will talk to you about the next steps needed to help you feel your best. Based on the specific thinking changes you are having, your doctor may suggest treatments for you or refer you to other healthcare professionals. These may include a referral to a neuropsychologist. A neuropsychologist is a special type of doctor that assesses thinking skills. They can help you determine which of your thinking skills have changed since your cancer diagnosis. They can also offer treatments and ideas to help improve your thinking. Your doctor or neuropsychologist may suggest a treatment called cognitive rehabilitation. The goal of cognitive rehabilitation is to teach you ways to handle or cope with your thinking changes. You may be referred to an occupational therapist. These healthcare professionals are experts in daily living. They can teach you ways to manage your thinking changes and offer helpful tips and aids for your use. It may also be helpful to work with a speech therapist if you have these types of changes. Based on your needs, your doctor may order medicine to help improve your ability to focus or concentrate. Referrals to other healthcare professionals can also be made. Your neuropsychologist or cognitive rehabilitation provider may suggest ways to help manage your changes in thinking. Here are some common tips that you may find helpful. Use a calendar for all of your planned daily activities, appointments, and important dates. Keep it in a place so you can check it often. This calendar can be written or digital. You may find it helpful to use a timer or alarms on your smartphone as reminders. Keep a medicine schedule and pill box to make sure you take your medicines as the doctor ordered. Set a daily routine and follow it. Try to do your hardest tasks at a time during the day when your energy level is at its highest. Keep a to-do list for things that need to be done and mark off each task as you complete it. Make sure your list is reasonable. Be mindful of what you are able to do. It is helpful if you can prioritize your list and break large tasks into smaller steps. Do one task at a time with as few distractions or interruptions as possible. Try working in quiet areas or use white noise to block out sound. Turn off the TV or radio when you need to focus. Prepare the things you need for the next day by laying them out before you go to bed. Keep important items, such as your car keys, in the same place, so they are easier to find. Maintain a healthy lifestyle. Eat a well-balanced diet and drink plenty of water. Physical exercise can help keep you mentally alert. Do activities you enjoy, such as walking, swimming, bike riding, or working in the yard. Exercises like yoga, meditation, or guided imagery may also be helpful. Include activities that support your relaxation and help manage stress. Let a family member or friend help when needed. Talk to your doctor to see if a counselor is needed to provide you with more support. Try to get enough sleep. Develop sleep habits, such as going to bed and waking up at the same times each day. Limit time on your computer, TV, or phone before bed. Keep your bedroom dark and cool. Limit your use of alcohol and avoid all tobacco products and street drugs. It is also helpful to not drink beverages with caffeine, such as tea, soda, coffee, and energy drinks, especially before bedtime. Review your medicines with your doctor to learn if any of them have side effects that could cause changes in your thinking. Research continues to look for the best ways to prevent and treat cancer-related changes in thinking. We hope this information helps you to understand why why people with cancer sometimes have these changes and how they can be managed. Write down any questions you might have for your healthcare team and bring them with you to each appointment. We are honored to care for you during your cancer treatment. Thank you for choosing the James.